Obesity rates continue to rise worldwide. We all know the serious conditions and chronic illnesses that can develop as a result of obesity, but risks for women also include fertility complications. Women often struggle with slower weight loss than their male counterparts, and in fact, 2 in 3 women in the United States are overweight or obese. Many studies in the past mainly focused on physical activity and diet. For this reason, this study aimed to answer the question, what factors contribute to weight gain in healthy women that ultimately leads to obesity? By using Google Scholar, ScienceDirect, and PubMed databases, searches were done using keywords like obesity, women, weight gain, and healthy. 11 empirical peer-reviewed articles were found. All were published within the past 10 years. Both local and international studies were included, and the women were between ages 18 and 64 and could not have any comorbid disease other than a diagnosis of obesity. When we look at the results, the physiological factors included the genetic polymorphism of the ALA-THR54 allele, and this was found at higher frequency in obese women and leads to insulin resistance. Anti-Müllerian hormones were significantly lower in obese women during menopause and over the next 8 years of the study. Vitamin D levels were negatively correlated with increased body mass index, waist circumference, and waist to hip ratio. Significant reductions in sleep results in decreased cortisol levels and increased leptin levels. Acute stress leads to elevated levels of cortisol and C-reactive protein, and therefore a higher BMI in females. For the environmental factors, women of sexual minorities have a higher prevalence of overweight and obesity. Food insecure women were more likely to be obese than their food secure counterparts. Median household income, population density, employment density, establishment density, and the lack of supermarkets were associated with a higher risk of obesity. The odds of a female becoming obese doubles with her history of sexual or physical abuse during childhood. And if other factors are controlled, marital status was not associated with obesity, but it is unlikely that these factors are controlled outside of an experimental setting. The results conclude that no single factor leads to obesity in healthy women. Instead, multiple factors, physiological and environmental, interact and can even overlap to aid in weight gain. There were some limitations to this study. The sample sizes were relatively small, and only one factor was tested for each study. Future studies should look to break up age ranges into a more concise range, as well as study multiple factors at once instead of just one. Race should also be considered, since previous studies have shown certain races to be predisposed to a higher chance for obesity. Thank you.